Let me continue with the previous session. We discussed about the global period or the global surgical package. When we talk about package, the itemization of services are all included. When we talk about the period, this package extends to certain well-defined time frame. That's the difference with the GSP, which is a global surgical package, which is an important coding concept when we want to do this surgery. Even people who are working on this E&M side or people on the medical billing side as well will have to understand the importance of this global surgical period because many such claims would have been there in their buckets as denials due to this global issue of violating the global period guideline. So, what happens when you are going to send a claim within the global period is that now the claim gets denied automatically because the payer systems have been organized in such a way that when a patient has undergone a previous surgery, the global period starts and the physician will be within this global period for a well defined time frame, and that depends on the minor or the major surgery. Now, if another service or another procedure is going to be reported during this global period, then the payer system gets alerted, then automatically the claim gets denied unless we are going to report modifiers. Though you are going to use a different diagnostic condition, that means coders will be using a different DX code which is separate from that of the previous surgery. But still, the claim gets denied, and you can only get the right payment only if you're going to employ the appropriate modifiers. We'll talk about the modifiers in the next session, but now we'll just focus on what exactly the global period is, how do we explain the services, and what are the implications if the global package rules are violated. As we have seen, we have distinct periods for the global period. We can classify the global period into three parts. One is the preoperative, the intraoperative, and the postoperative. Well, let's see what is the meaning of the preoperative period. As the word states, it is preoperative, which means before the operation or before the surgery. Now, this is a time period where the decision to have the surgery and the beginning of the surgery. It's a time period where the physician has decided to do the surgery till the time period where the surgery is yet to begin. Now, this is a very critical and sensitive period because it is during this time that the clearance for surgery will have to be done. The anesthesiologist will be conducting a thorough examination and she will be deciding what exactly the type of anesthesia should be considering the comorbid conditions of this patient. Depending on the physical status of the patient, the anesthesiologist will determine the type of anesthesia that needs to be applied. Moreover, the cardiologist will also do his own examination so that the candidate is fit for surgery. So, this is a very critical and sensitive time period during which the patient is being subjected to a complete examination prior to surgery. And this is what we also say it as the routine pre-operative visit. In case the patient's condition does not warrant the performance of the surgery, which could be a scheduled surgery, then they will have to cancel the surgery. All possible information about the patient is collected and collated, and then the surgery continues. The preoperative period is just one day for the major surgery. You all might know very well that when a patient is supposed to undergo a major surgery, this patient will have to be hospitalized or admitted a day prior to the actual performance of surgery. So, why do you think so? It's not for any other convenience. Now, it is on this day, all possible examination is being done to this patient, and that the physicians and surgeons will have to give a green signal for the performance of surgery. So for major surgeries, we have the global preoperative period is one day, and there isn't any such global preoperative day for a minor procedure. Let's talk about the intraoperative period. It is during this period the patient is being transferred to the operating bed. So patient is now being taken to the operative bed. Now once he is being taken, patient will be given anesthesia. Now, prior to the start of the surgery, the patient will be administered anesthesia. So, the anesthesia time starts well before the surgery and ends well after the surgery. This period, this intraoperative period, it ends with the immediate post-surgical recovery care. And for all major and minor procedures, the intraoperative period is just 1 day. Patient might develop intraoperative complications on the same day, which will be addressed by the treating surgeon. Please understand that the anesthesiologist nor the assistant surgeons are bound by this concept of global surgical package. So, this concept only applies to the primary surgeon who is taking care of this patient or the person who does the surgery. Postoperative period refers to the post surgical time period. So during this time period, where the body tries to recover from this anesthetic shock and the surgical shock. So it's a recovery period where the body attempts to maintain systemic homeostasis. As we all know, homeostasis is a state of equilibrium, the internal equilibrium that's being maintained, and all the post-surgical complications. Patient might have abscess formation, or might have severe pain, or patient might have hemorrhage. The complex complication with any surgery is hemorrhage. Now, all of these would have to be treated by the surgeon. For minor procedures, there are procedures which have 0-day global, and some other procedures have 10-day global post-operative periods. And for major surgery, the global post-operative period extends to 90 days, which means roughly for 3 months, the patient is within the care of the surgeon who has conducted the surgery. Any problem which arises that is related to the surgery will have to be taken care by the attending surgeon. Unless it is going to be an unrelated condition, the global surgical package includes certain services and we call them as the bundled service. The payment for all related services and supplies are bundled. We use this term bundling in coding and billing. Bundling refers to inclusion of services. Certain services are included. Imagine a minor procedure being included in a major procedure. We call that as bundled. Same way, change of dressings and routine pain management. And whenever there is a minor or major procedure, patient will have to come back for the removal of sutures. All of these fall within the scope of bundled services within the global post-operative period. Imagine if the physician is also making use of certain supplies, certain drugs, certain medications, painkillers. Those are also included within the global surgical package. Now, what is the importance of knowing this global surgical package? Many times you find there could be a lot of denials. There could be claims that are being denied to the insurance company for this one global issue of violating the global surgical package. Whenever you are going to address a claim, and if that claim is being denied, and if you think that all the codes in place are correct, then you need to think if the patient is within the global surgical package or not. You can very well make out from the AR comments as to what exactly is the cause of denial for this particular claim. You yourself can read those AR comments, or the insurance company might state that the issue is with the global package. Then you will have to go back and see the previous claims and see for yourself if the patient has had any surgery within the past 90 days. Imagine the patient be presenting on the 88th day of global surgical period. But still, the claim is within the global surgical package, and so this encounter or this visit would be nullified, and the insurance would consider it as a routine post-operative visit. To show it to the insurance company that the claim is within this global surgical period and that it is a non-billable service, we have this code 99024, which refers to a no charge. It refers to a service which has been related to the previous surgical service. You will have to be literally armed, especially while dealing with the denials related to global periods. Because we'll have to bypass the denial and we'll have to show to the insurance company the patient has come for a different purpose, unless the patient is coming for a different purpose, so that you can get the service, get paid to the physician by the usage of appropriate modifiers, which we will see in our next video. I hope this session will be of immense help to you. If you have any questions or any clarifications, please post in the comments, and I'll see you in the next video. Till then, goodbye.